We are here in DeBakey CV Live today talking about vascular surgery residency. Join us in the future for more topics. Today we're going to be talking about you matched, now what?
So as you guys know, match day is coming up exactly 10 days from now. That's going to be Friday, March 20th, 2020, which for a lot of people who may be following along, and for me also, wasn't that long ago. One of the big things that happens on that day is you open your envelope and you find out you match to vascular surgery, and the first thought that's going to go through your head is, all right, I guess I'm going to be a vascular resident. What do I do now?
That's right. And for those of us that are residents, we're kind of removed from that moment, but I can personally remember that moment 4 years ago when I opened my envelope and matched into vascular surgery. And for those that are not in the medical field that are watching us today, Match Day is a huge day for all fourth-year medical students across the country. It's the one day where every single fourth-year medical student in the entire country opens an envelope and they know where they will do the residency for the next 3 to 8 years. And that's why it's such a big deal for us. But now that the match day is coming up, hopefully all of you residents have already submitted your rank lists and are anxiously waiting to see where you will end up. Next Friday you will find out where you will be. But once that moment comes, you really kind of have to start to prepare for residency from that time moving forward. And there are a number of ways to prepare for residency, and we kind of want to talk a little bit about what to do once you know where you've matched. And I think for me, when I think about the moment that I matched, I was of course very happy and thrilled to have come here to Houston Methodist for residency. But one thing that we have to remember is that once you're a resident, you'll be extremely busy. Tell us a little bit, Yusuf, what you did in fourth year of medical school before residency started.
So I'll be perfectly honest, a lot of nothing. I sat around and wasted a lot of time knowing that I would be very busy again once residency started. But the main sort of things that I personally got out of the way early, so I got lucky in that I matched at my home institution, which is why I'm here. And so for me, I had quite a bit of support from the residents, including you were one of those residents who helped me out when I had matched, as far as letting me know what sort of things I would do, or I should do. One thing I will say early on is get your logistic stuff out of the way as soon as you can. Like, you're gonna have to get for me, I had to get my Texas license. I had to get all my vaccinations in order. I had to get all of my paperwork. I had to get all of my DEA numbers. I had to get all of my paperwork submitted to the hospital. If you get that stuff out of the way as early as possible, it definitely makes life easier later on, because if you're struggling last minute to solve those types of problems, you're going to A, get in trouble with your program coordinator, and B, you're just going to have a tough time, and you're going to have to postpone your vacations. You're going to have to postpone having free time because you're going to be struggling to get those things done last minute.
That's a great point. I mean, I think getting the logistics taken care of early is very important. Another part of matching and moving to a new city for many of us is kind of finding a place to live. And I think a very important thing is to decide where you're going to live and to get started early trying to figure that out and finding your apartment or your house, because you definitely don't want to be scrambling last minute trying to move to a new place. I definitely recommend moving to the city where you're going to be training for residency maybe a month in advance if you can do it, because that will really help you settle in.
So I grew up in Houston. You are not from Houston. So how did you choose, where am I going to say, with vascular residency, you can expect, especially in your junior years or so, when you're not as comfortable with patients and when you're still learning, you're going to be spending time at the hospital. There's going to be times where you need to get to the hospital a lot earlier than usual, just because, you need to pre-round earlier than usual, or you need to do tasks during the evening, et cetera, et cetera. So how did you sort of decide, get to know Houston and where you're going to live?
Yeah, that's a great question, and I think to that point, it's very, very important that wherever you end up living, it's near the hospital, if possible, as an intern. Sometimes, depending on what city you're in, that may not be possible because all the locations near the hospital may be extremely expensive or may not be a safe place to live. But if you can find a place to live that you can walk to the hospital or bike to the hospital or drive your car and get there in 2 minutes, that's very important because, like you said, intern year, you're going to be extremely busy. And you don't want to spend your free time driving or stuck in traffic. For me, in terms of Houston, the way that I discovered that was talking to the residents who were there already. So you want to ask the upper level residents where they live, how they found the place where they were living, and what areas of town are safe, what areas of town are expensive, and that will help direct you. Another thing that's really important, I think, during 4th year of medical school, once you know where you're matching, once you've taken care of your logistics, is I think doing things that you enjoy, and for me it was spending time with family. I think the reality is that during residency you'll be extremely busy, and many times you won't get the opportunity to spend an entire week or a month or a weekend, whatever it is, with your family, or to go on and do activities and hobbies that you enjoy. So really taking advantage of that 4th year to do that is important, I think.
Yeah. No, I completely agree. As far as finding places to stay and sort of the logistics things, I think one thing that you can't overstate is that your program coordinator is your best friend, like by far. I mean, this is someone who has probably lived in the city that you're matching to for a very long time. This is someone who's seen generations of residents go through the program. This is someone who knows what the program director expects, what the chairman expects, what all the attendings expect. And honestly, our program coordinator, Sandra, was wonderful. I mean, I was text messaging her quite often just trying to figure out, like, hey, did I do this form right? Hey, what do you suggest as far as this? What is this is the program going to take care of this for us, et cetera, et cetera. So no matter where you match, get to know your program coordinator and get to know all the ancillary staff, because they will make your life a lot easier as far as getting started.
Absolutely. I think all of those are great points. So now you've matched, you've found your place to live, you're excited to move to a new city or maybe to a new location in the current city where you're living. Tell me a little bit about how you prepared for intern year, or how you think that interns should prepare for intern year. What are some important things to think about, some important things to do in those months leading up to intern year?
So the classic advice you usually get when you ask these types of questions is you should just enjoy yourself, because this is the last time you're ever going to be free. You're not going to have anything to do for the next 5 years or so. And I think there's quite a bit of value in that. But at the same time, I think that can easily be taken overboard. A lot of people stack their 4th year vacations and their rotations so that from January onwards, you're not doing anything. I mean, you're basically having zero patient contact. You're not really involved in anything. I would say a few things that I personally did. There were rotations that I wasn't very busy on, but I knew I had to be in the hospital for whatever reason. I would just come scrub cases with the vascular attendings, because if I have to be at the hospital anyways, then I might as well get some experience, get some familiarity with vascular surgery. Because I was there in the morning in the hospital anyways and I wasn't doing anything, I would still come to vascular conference that was going on, just to keep up with things and at least show my face, get to know everyone, even the people that I didn't know. As far as like reading and like skills and stuff are concerned, my perspective on skills is that if you're not doing perfect practice, then you probably shouldn't be practicing. And that's why I would say, like, matching with scrubbing with cases is important, because then you're getting actual supervised practice instead of, unless you're already really good at it, sitting down at home and tying knots the wrong way 100 times isn't really going to help you much. So, if you can get someone to mentor you, if you can get someone to do that, then excellent, but I don't think it's something that you necessarily need to push. Knowledge-wise, I think that's where things get a little bit different. There are definitely basics of vascular surgery that I don't think it is okay to start internship without knowing. So just basic anatomy. So going, at least knowing that the aorta bifurcates into the iliacs, is probably a good starting point, right? So maybe, not going into every single branch of the thoracoacromial, but like knowing generally where things are, knowing the major branches, and knowing sort of the main things that you're going to be expected to know, the bread and butter of vascular surgery before you get to internship is important. And that's not like a month or 2 month long study experience. That's a week of just skimming through a vascular surgery textbook or like a vascular surgery study guide and going through that. So.
Yeah, I completely agree on the knowledge aspect of that. I think it's important to read, and going your entire fourth year or 6 months of your fourth year without reading anything and showing up intern year day one and expecting to be functional, I think is not the wisest of ideas. In my opinion, I think that you should, fourth year, when you have a little bit of extra time in medical school in fourth year, you should start to develop a habit of daily reading. And so my advice to fourth years out there would be, it doesn't have to be all day, you don't have to sit in the library all day, but if you develop a habit of 15, 20, 30 minutes of reading daily, pick up a vascular book and read part of a topic, if that becomes a routine in your life in the fourth year of medical school, then you will be able to transfer that to residency. And I found that one of the keys to being a successful resident is to be continuously reading and continuously learning. And if you can do it in small bites and develop those habits early on, I think that will be huge for your residency career, and it will certainly add up and become exponential and be very beneficial. On the skills aspect of surgical training, obviously, surgery is something that requires a lot of practice. It's not something where you can pick up a book and learn to operate. It's something that you have to develop muscle memory. You have to develop these fine motor skills that very few of us are born with. It's something that is acquired through many, many hours of practice, just like playing an instrument, guitar or violin. And I think my opinion is that most of your surgery learning, your skills learning, should be done outside of an operating room. I think the operating room is not a place where you kind of go to practice surgery. It's a place where you go to execute those skills that you have already learned outside of the operating room. If you do a vascular case, you may be doing 1 or 2 anastomoses in a vascular surgery, but if you learn to do a good anastomosis and you learn to practice anastomosis outside of the operating room, you can do 200 anastomoses in 1 week or even more, depending on how much free time you have. So the amount of practice that you can do outside of the OR and the amount of skills that you can acquire outside of the OR can be very, very, very significant. Yeah. And when you're in the OR, you're able to execute those. So my advice for fourth years out there that have matched into vascular surgery or general surgery for that matter, or any surgical specialty would be, obviously have somebody teach you how to sew, teach you how to do knots, so that you're doing that properly. I think the supervised
part is the important thing.
That's very important.
Perfect practice makes perfect.
Absolutely. But once you know the way to do it, then it's all about practicing, and practice should be every day. And it doesn't have to be, you don't have to spend 8 hours a day practicing, but 5 minutes a day, 10 minutes a day will actually make a huge impact on your education and on your skills when you start residency. So there's a number of training courses out there that are designed specifically for fourth-year medical students entering vascular surgery. I'm sure there's some for general surgery and other surgical subspecialties, but can you tell us a little bit about that? Did you ever go to any of those training courses?
Yeah, so SCVS, actually, I went to SCVS right before I started residency. And that one was nice because they have like this sort of like little skills boot camp there that you can participate in even as a medical student, I believe, which unfortunately is canceled this year because of the coronavirus. But just to plug our own institution, and hopefully everything goes well and it does happen this year, but we have what's called our pre-intern boot camp, which we all know about, where pretty much every intern across the country who's matched fresh into vascular surgery is invited. There's skill courses supervised by a lot of really great vascular surgeons from all over the country. We have there's lectures throughout the day on line placement, on basic anatomy. So a lot of what we said earlier is like, what does your knowledge base need to be? What does your skill base need to be? It covers a lot of those topics essentially. You know, each of those PowerPoints that I remember we got, or those lectures that we got, were essentially designed to cover the major topics that you might experience in that first week of internship. And again, it was all the bread and butter stuff, not like the crazy rare, super intense anatomy that you might see like, you know, once a month or once every few months, but it was all the bread and butter stuff. And so I really appreciated it for that. And also it was a great opportunity. So one thing, you know, a lot of people have these WhatsApp groups, right? So there's like these residency application WhatsApp groups, and I'm still part of the one that from my graduating class. And I'm sure all the people who are listening or going into match day are probably also part of that same WhatsApp group. It's a great opportunity to like hang out with everyone at once. It's probably one of the last times that you're going to see everyone there all at the same time. It's a great opportunity to build bonds. I mean, you know, when I go on vacation a few weeks ago, you know, I ran into a few people, and it's great. Like, you know, and I think, you know, just as much as knowledge and skills and everything is a part of vascular surgery, we're a small community, right? Like, you know, networking is as much of it as anything else. So,
thank you. So we've kind of talked about everything leading up to intern year, and we're gonna go ahead and take a short break at this moment, and then when we come back, we may talk a little bit about the actual beginning of intern year and kind of what makes a good intern, what are people looking for in an intern, what your attitude should be as an intern, and I highly recommend for everybody watching us to subscribe to our YouTube channel at DeBakey CV Education. You can also find us on Twitter at DeBakey CV EDU, and we'll be back in a few short moments.
Hello, I'm Dr. Alpesh Shah from the Houston Methodist DeBakey Heart and Vascular Center. I'd like to invite you to join us in Houston, Texas for the 4th annual Cardiology for the Non-Cardiologist Conference. This special event will be held on June 27, 2020 at the Houston Methodist Research Institute in the Texas Medical Center. This one-day conference teaches non-cardiovascular physicians and healthcare providers to identify common risk factors, guidelines, and treatment approaches for cardiovascular diseases. You'll learn about the latest medical and surgical therapies for heart disease and advances in managing common clinical cardiovascular conditions. Our expert faculty will also discuss the clinical challenges often associated with caring for patients with heart disease. The course is designed for physicians, mid-levels, and nurses specializing in cardiology, internal medicine, primary care, family practice, critical care, and emergency medicine. We also encourage residents and fellows in training to attend, as well as physical therapists, radiology technologists, and sonographers. I hope you'll join us and look forward to seeing you in June. Thank you.
Cardiology for the non-cardiologist. This is a unique photo. Within one day, you can get really a capsule of what's the latest in cardiovascular medicine. This is aimed at all the people that interact with the cardiovascular field. There may be primary care physicians, there may be nurse practitioners, allied health professionals, obstetrics and gynecologists, ophthalmologists, and that's what we've seen in this conference is the breadth of people that interact with cardiovascular disease and interact with the cardiologist.
I'm an ER nurse by background. Your heart is important. It affects every single patient that we see and we treat and we care for. I love cardiology. It's something that interests me and I wanted to learn more.
Obviously, cardiology is advancing every year and new treatment options are available. So it's good for me to keep up to date with the information that's being introduced in the cardiology field, and it allows me to help my patients.
Welcome back to DeBakey CV Live. Again, my name is Manuel Rojo. I'm one of the fourth-year vascular surgery residents here at Houston Methodist Hospital. And I'm here today with Yusuf Chauhan, who is our second-year vascular surgery resident. And we're talking today about kind of that transition between medical student and intern, vascular surgery intern. We talked a little bit about what to do during your fourth year of medical school once you've matched, and how to kind of maneuver the moving into a new city and finding a place to live. We talked a little bit about the practice that you should be doing and the reading that you should be doing before starting integrated vascular surgery residency. And now we'd like to transition a little bit to the first day of intern year. So tell us a little bit about your first day on the vascular surgery service. What was that like?
Yeah.
And any advice, tips for your young colleagues coming up through the ranks?
Mm-hmm. So thank you for asking what my first day on the vascular service was like, because I actually started on a cardiology service. So it was a little bit different than most people's experience. But my first day on the vascular service was hectic. It was stressful. And I felt like I was playing catch up all day. And I don't think that is an abnormal experience for anyone to have. Vascular surgery is a very intense field. We do a lot of cases, we do a lot of operations. We have a lot of attendings who do a lot of cases here. And so, there's always things happening. And, I will say it took about a week to a week and a half for me to just get in the stead of things. One thing I had to discover for myself early on, and I found that this was more valuable than sort of my knowledge and skills base, at least at first, was my organization skills. I think as an intern, there's so much coming at you, and there's so many expectations for you, that being super organized from day one is very important. For me, that meant having 3 different colors of pens and a highlighter, and I had a system on our list of using boxes and circles and stars depending on the acuity of something. And that system worked very well for me. It may not work for everyone, but I had to figure out how I stayed organized, and you're a chief, and your understanding of what makes a good intern is more than likely a bit different from mine. But at least what helped me be a good intern was being very organized from day one. The reading was important, being in the OR was important, having good skill set, like placing lines and doing that kind of stuff was important. But being organized is what allowed me to be good at the other things.
Great. Tell me a little bit about the attitude that one must take as an intern, because you come from medical school where you're a fourth-year medical student, where you're kind of at the top of the food chain. You've finished all your kind of pre-clinical years. You've done your step 1 and step 2, and you've matched, and you're kind of living the dream, so to speak. And then you come to a place where you've now become kind of the lowest man on the totem pole, and that can be. I find that transition can be a bit difficult and rocky for some people. So tell me a little bit about the attitude and kind of that it takes to make that transition.
I will say that at least at our program, we're fortunate that we have a relatively we all get along with one another, and we're all very good to one another. And so, my experience might be a little bit different from others, but I think the one thing that holds true is as an intern, you don't know what you're doing yet. And you have to do what you're told. That doesn't necessarily mean just like shut your eyes and blindly do what you're told. Ask for rationale, because that's important for your learning. Ask for an explanation. If a chief resident tells you, well, I want a CTA instead of a CT with IV contrast, I want to, ask questions. And not necessarily, what I don't mean is challenge them. What I mean is ask, okay, so why are we doing a CTA instead of a CT with IV, et cetera, et cetera, et cetera. I think, the attitude has to be, you do what's expected of you, and at the same time, you take that opportunity to learn as much as you can. Don't just do things because you were told to do them. Do the thing and also understand why you're doing it and the rationale for why it's done the way that it was asked for you to be done. I think that makes you both a better resident, and it makes you a useful resident to the rest of the service.
Yeah, I think those are great points. Is really making sure that as an intern you're understanding things, so that you're not just going through the motions, but you actually know why you're doing what you're doing. And I think, looking back, I have to say that intern year was definitely one of the hardest years of my life. And I don't think that there's any resident that would deny that intern year can be one of the hardest years in a person's life. And it is a big transition, because you go from kind of having your hand held during medical school to now being in charge and kind of being responsible for real patients and with real issues, and your decisions and your actions matter, and you're no longer paying to be educated, but in fact you're being paid to perform a job, and you're being paid to contribute to a team. And that transition, I think, is huge. And I think there has to be, in order for somebody to be a successful intern, there has to be a shift in their mindset. When we're medical students, I think it's all about us, and everybody is worried about, what am I getting as a medical student? I'm paying these astronomical sums of money to go to medical school, and getting into more and more debt. And as medical students, it's really important to me, what am I getting? How am I being educated? How am I learning? How am I getting to my next goal? As an intern, that has to shift, and it has to shift significantly, because now it no longer becomes about you and your education, though that's important. Of course, intern year is an educational experience in many ways, both personally and in terms of professionally. But there has to be a shift, and it has to be now about the patient, and the patient has to come first, and the patient's care and the success of your team has to come first. And so I think that change from an individual perspective, where how do I learn and how do I become a better medical student, to how do I make my team succeed and how do I take care of a sick patient and get them through their hospitalization, is a huge change. And I think that can be where interns can struggle. I remember when I was a medical student, obviously I was fascinated by surgery, and I got to scrub in some phenomenal surgeries and some huge operations that were very, very impressive. And that's what drew me to surgery. It was the fact that I got to see some really amazing procedures. And then I remember going in and becoming an intern, and I was no longer, scrubbing these amazing procedures. I was doing dressing changes on the floor or writing notes. And it's kind of a wake-up call when you go from that. You
do more aortic cases as a fourth-year rotating student than you do as an intern.
Yeah, that's a great point. And I think, it varies from institution to institution. Some institutions obviously treat their medical students, fourth-year medical students, much more like interns and have them probably better prepared for intern year, whereas other places it's more like a observership, where you're just there seeing the great parts of surgery, but you don't really get to see the daily struggles and the dirty work, so to speak, of surgery. And tell me a little bit about your kind of that transition, and was that difficult for you, and not being in the OR as much as you anticipated, or were you expecting that?
So again, I think we're fortunate in this program in that as interns we do get to go to the OR quite a bit. Maybe not in your first or second month as a vascular intern, but definitely in my third or fourth month as a vascular intern, I was in the OR quite a bit, which was nice. It was very much appreciated. But you're right. I think my experience with fourth year rotations was I did rotations in places where you were treated as an intern, and therefore you see the sort of daily grunt work, sort of the dressing changes, carrying around a pack of Curlex in your backpack and that kind of stuff. But yeah, it's a huge change, knowing that there's some crazy fancy cool operation that's going to be written up in a journal later on is going on while you're on the floor answering a page every few minutes while also wrapping up someone's foot from toe all the way up to their thigh. It kills you inside a little bit. But I think for me it was just knowing that one day or soon enough I'm going to be the one who's going to be in the OR, and there's going to be someone responsible taking care of the patients on the floor while I'm in the operating room. And I think it's just a matter of perspective. Delayed gratification is the hardest thing in the world, but residency or the entire story of medical training is delayed gratification. So you just kind of have to accept it for what it is. There's really no fighting it. If you can come to terms with it, great. If you can't come to terms with it, then just keep your mouth shut and do what needs to be done, honestly.
Yeah, I do want to encourage the fourth year medical students that are going to start intern year here in the summer. I want to encourage you that the role you play as an intern on the team is crucial, and I think intern year is a time for us to really kind of dig deep and find that reason why we went into medicine in the first place, because intern year is when you actually get to be a true doctor, and you get to do everything. You're kind of the first line. You get to see the patients first when they come in. You get to do kind of A to Z and manage their pain and manage their nausea and think about kind of every aspect of a patient's care that you may not think about once you're kind of a chief year, where you're kind of more focused on their surgical problems and their operations. So intern year is really the time to become a doctor. I think you earn your MD after completing medical school, but I don't think you truly become a doctor until you've gone through intern year and second year, and you've actually been able to take care of patients from A to Z and manage their diabetes and manage their cholesterol and put them on this aspirin and Plavix. And so I want to encourage interns that though they may not see the OR as much as they wish during this coming year, that it's not a useless year.
And you will be in the OR, and then you will have reliable interns who are going to be, taking care of things so that you can be in the operating room. So,
great. Well, definitely want to conclude with that. It's been a pleasure, talking to you today, and it's an exciting time in medical student education, where we're gonna make that transition. And I wish all of you out there listening the best of luck in these coming months in the match.
In 10 days.
10 days. So. And again, I want to encourage everybody to subscribe to our channel, to our YouTube channel, DeBakey CV Education, as well as our Twitter account, DeBakey CV EDU.
All right.
Thank you, everybody, for joining us.